Amy Saleh. I'm a chief resident here at Mayo in the 5th year program of ENT, or otolaryngology, and I went to Ecuador for my trip in Quito, and we did a surgical missions trip, particularly focusing on children with cleft lip and cleft palate. The main focus of the trip was to do as many surgeries on as many children as possible. We were operating long days. It started at about 7 or 8 in the morning and go to about 7 or 8 at night. Here, those children are plugged in oftentimes before they're even born. You know, sometimes it's identified on ultrasound and they'll be plugged into this whole clinic, at least nowadays. I think things have improved over the years, where they'll see a multidisciplinary committee from the day they're born until they're well through their teens and even into their adults sometimes to have all of their issue addressed. Whereas in those countries, they simply wait for these missions to come by. And you have very limited resources, and it's always amazing to me how much we can get done and with that amount and how much waste we have here. The minute you finish surgery, the child looks like a completely different person because they don't have this big gap in their face anymore. They have this nice neat line with sutures in it and a little bit of dressing over it. You get these immediate results that are so astounding that you just can see results immediately. And then the palate, you've immediately closed those tissues, so while they're sore and stuff, no longer can food go up into their nose or speech, and so the results are fairly immediate. I didn't get a large experience with cleft lip and cleft palate here in my own institution. Just is not as common. There's certain ethnicities where it's more common and stuff like that. And so I get a lot more compact experience doing multiple surgeries time after time. Like any technical skill, you get better at it if you do it in a short period of time over and over again. Learning how to run a trip like that and how much goes into it and seeing, you know, what type of resources, what type of organization has to happen, things like that was very educational. And I think that you enjoy feeling that you're really needed and you're really doing a service for something. But then the whole reason we went into this profession is to try to make people's lives better, and I think we do that even with a short interaction. And I just think any cultural experience and exposure is helpful to anybody. It just gives you a different perspective on the world. The Mayo International Health Program, I think is a great opportunity here at Mayo. They offer a scholarship, and you have to write up why you want to do it, and you have to have a good place to go and somewhere in mind that they know is you're going to get a good experience from. But really, they offer it to anybody, and I don't think that's common most other places. I think the opportunity for that is much greater here. Almost all of the parents and the children, the ones that were old enough, were extremely grateful and very accommodating, and they wouldn't have been able to have done otherwise. It would have been absolutely prohibitive for them. Sometimes parents were even in tears because they finally could get something like that addressed.